Hello guys, this is Doc Rod of Doc Rod TV. This morning I am here right now having a hands-on line live course under Clinician Choice. It's a clinical research dental. Yes. So under instructor Dr. Robert Margeas, and it's regarding class 5 restoration technique. Yes, that's what I'm having right now. Hello guys, this is Doc Rod. Welcome to my channel. So guys, I'm having a hands-on line live right now. I received this package from Clinical Research Dental, and this is a class 5 restoration technique by Dr. Robert Marquez. So I'm gonna open it. I'll see what's inside. So I'm gonna show you what's inside this hands-on live kit from Clinician Choice and also Clinical Research Dental. And what's inside is the course instructions, of course, and also hands-on technique guide, like how to mock up, create lingual matrix, create bevel, and also the polishing. And there's bonding materials here, the MPA, and also there's a template materials. And I love this instrument by Dr. Ronald Jordan, composite series REJ number 4, and also the model that we are going to practice. And now this is the composite that I've been using, and it's a very nice composite. It's an Evanes nano enhanced universal restorative. It's single dose, and this is by Clinician Choice.
There's an enamel incisal. Exceptionally well for crown and bridge too. This is my go-to material. Prior to prepping a tooth, I'll make a template matrix material in my temp tray, where I have the ability to put that in the patient's record, so that if they ever break a temporary, I already have that ready to go of their pre-op model. So when I'm doing this in the patient's mouth, what I want to do is, the important thing to remember is you really want to get the incisal edges for sure of the tooth. So I'm going to inject this material. Like this. And what I want to do, I can take my finger and I can literally hold that right there. I want to make sure that I get at least the facial incisal line angle of the tooth. And then what I'm going to do is I'm going to break that piece off. Once that sets in the mouth, I would say it takes about 30 seconds to set. Maybe here, maybe it may take a little bit longer for it to set because it's out of the mouth, but I can see that it's starting to set. This is a very unique material, because it was meant to be actually used, as it stated, as a temporary matrix material versus, let's say, a blue mousse or material like that. Okay, so that seems to be ready. I can go ahead and peel this off, and now I have my lingual matrix. now that we've got our lingual matrix ready to go, what I want to do is this. I'm going to do a bevel, and then I'm going to score this lingual. So the important thing about the bevel is you want to make it long and you want to make it deep enough so that we have the ability to hide that margin. It's really, really critical to be able to hide that margin. So I'm going to take my flame-shaped diamond that is in the kit, and what I'm going to do, I'm going to take that and I'm going to start to bevel my tooth. Now, you can see here, let me get the other diamond. You can see where the DEJ is, happen to be where on this tooth, right here, the dentin enamel junction. Now, I don't want to expose the dentin, but I want to be very, very close to the dentin where that fracture line is. Why? I want to be able to place the material on here, but still have room for my enamel. If I don't take enough away, I can't block the fracture line. I would say that's what I see the most with the failures of a class 4, is that it wasn't beveled deep enough and we weren't able to hide that margin. So what I'm going to do here is I'm going to bevel this. Deeper on the fracture line where that is. And I want to make that longer. It's got to be about a 2 millimeter bevel so that you can really hide that fracture. If you don't make it long enough and deep enough, you're never going to be able to put the material on that tooth. So you can see this is where the DEJ is right here. I'm not exposing it, but I'm bringing this out here like this so that I can get the material on the tooth. And then on the lingual, all I do on the lingual is this. I'm going to do a small little bevel here. This does not have to be long. This can be a shorter bevel because it's not going to show. If I do a short one on the facial, if I do a short bevel on the facial, it's going to show. And then I can kind of round this here in the interproximal. Okay, let me blow that off and show that to you. You can see on the lingual, let me zoom in here a second. So you can see that. On the lingual, it's just a small little bevel. On the facial, it's a longer bevel of a couple millimeters. All right. It kind of disappears. It's like almost like a disappearing bevel. And I want to show you up close here. This is where the bevel is, right here. So from the fracture line, it's a couple millimeter bevel. I want to make that just slightly deeper here. And then in order to simulate the etch, what I want to do is this. So you can kind of see what that looks like. Is you have to over etch the bevel. You don't want to stop the etch on the bevel. You want to etch past the bevel. So I'm going to just take this and roughen this up a little bit so that the material will stick to it. You'll see kind of like a frosty appearance. Okay, it's not really, beveling the tooth much, but it's like a frosty appearance. And what I want to do is just to be able to blend that in, okay? And so we're going to stop our composite somewhere up here on the tooth. We're not stopping the composite on the bevel. We're stopping it past the bevel. So that's basically simulating the etch, taking the shiny appearance off of that tooth. So the important thing to remember here is this, that you have to have that long bevel. If you don't, you're not going to have the ability to disguise or camouflage that bevel, and you're going to see shine through, or you're going to see a white, very opacious layer. So once I have that, what I'm going to do, take your lingual matrix, place it on there, and then what I want to do is I want to scribe a line onto my template matrix so I kind of know how much material to put on. Okay, you can see that's what I'm going to put on the tooth. The important thing to remember is when you're etching this tooth, you don't want to get etch on the adjacent teeth or the adhesive. So I'm going to take some MPA, maximum performance adhesive. It's meant as a 5th generation. One, would be like single bond onto the tooth. You scrub it in. You can use the micro brush or you can use a mini brush. I actually prefer to use like those micro brushes more than I do this brush. But I'm at my wife's dental office today and I wasn't as prepared. So I put that on there. What you want to do is whether you're using All Bond Universal, MPA, Scotch Bond Universal, you want to make sure you scrub that for 15 to 20 seconds, and then you want to air thin it and evaporate that solvent. You want to make sure that you don't get any air. You want to get rid of the solvent, and I want to do that until there's no movement, fluid movement of that. Then I can take my strip out. Now, where I place that line is where I want to place my material. So I'm going to take my achromatic enamel called enamel white. All right, I'll place that back into my Tompoject, and what I want to do is express that out onto my matrix. And what I want you to be able to see is I'm going to put this on in a very, very thin amount. Okay, so I take the first part out, I dispose of it. Now I have my tip here, and I'm going to place that material on my lingual matrix. So I then take my REJ4, place this into my lingual matrix, and I'm just trying to capture that lingual bevel. And this is a very, very thin layer. Okay? Very, very thin. All I want this to do is be a rampart for my next layer. You'll see here it's very, very thin. I placed it very, very thin, and then I can take this to the mouth. And what I want to do is place that there, and then go ahead and thin it out. You'll notice here the key is that it does not go onto the facial. It does not go onto the facial. It's only capturing that lingual. Okay? And then I'm going to light cure it. All this is a rampart for my next layer. This is not for strength. This is to create that translucency. If I don't have this translucent material on the lingual, I'm not going to be able to copy the adjacent tooth. And what I want you to see on the adjacent tooth is this. Do you notice that when I look at the tooth here, you can see all this translucency here in the interproximal, and then at the edge where we have 3 dinky little dental lobes, and then it comes up translucent. This is what this is going to be able to create, that translucent. So when I take this off, look at how thin that is. It's as thin as paper. It matches the trans of the adjacent tooth, and you can start to see what I'm trying to do. If you brought it out to here, which is about right there, you have no room for your dentin. You have no room for the dentin. This is only to hold the material for the next layer. So don't worry if you don't have a contact here. It doesn't matter, because when we do our pull-through technique, you're going to have a perfect contact. We're not going to use wedges. We're not going to use matrices and hold it. You're going to see exactly how we do that. So go ahead and get that part done. Once again, the thinness of this lingual. You can see it does not come out to the facial. If it did, you would not have room for the dentin. Now, I want to create the translucency. Look at the translucency in between the teeth. So I have to keep the dentin out from going into the interproximal. So what I'm going to do now is I'm going to take my dentin shade, B1D. If you look at these different caps, the dentin is dark, the enamels or achromatic enamels are white, and the universal is gray. That's the way you can tell the composite, the darker one being the black. So I'm now going to take my dentin shade and I'm going to place that onto the bevel. Now pay particular attention to this, because if you don't do this correctly, you're not going to be able to block your bevel. So this is what I mean by taking like a little piece off. As it comes out, what I'm going to do is take the first little bit off like that. And I'm going to come here and I'm going to place the material onto the bevel. Okay, like that. I put on more than I need. And then what I'm going to do is blend this into the bevel and create my dentinal lobes. So, you see where the dentin is going into the interproximal? I'm going to keep that shy of that interproximal in order to create the effect. And then I've got to create what? Those three little lobes, like the adjacent tooth. You can see when on my black background, see those three little lobes, those fingers? I want to try to create that. And what I'm going to do is thin this material out, but I want to block the fracture line. So what am I doing? Smudging it out, blending that in, and I'm going to continue to make my little lobes. And then I blend that into, so if I'm looking at this from the front, I want to create this little effect here, those three little lobes. So I can see the one that was already there, that would be that one, it's already there, so I'm going to create two here, and want to keep it out of the interproximal. But if you see where I added the composite, where you can see that line, that's not good. I have to come back here and blend this into the tooth. You can see that. It's too thick. So what do? I smudge this into the tooth to block the fracture, and I keep on blending that in till it really disappears. I want this thin enough so that you don't see any fracture line at all. Blending that in and then thinning it out as I go. Okay? It's blending in. You're starting to see it disappear. Very critical if you have a fracture line. And it's also critical to be able to have a material that can blend in. I would say Filtech Supreme dentin shades are very, very nice. New one from Ivoclar called Tetric Prime. Very, very nice colors. There's a lot of them on the market that can work well, as long as the material does not, slump. And I want to have room for my enamel layer. So if I'm looking from the incisal, look at this here. I still have room for my enamel. I don't want this to be too far out so that I don't have room for my enamel. You can see I have room there. So you can start to see that this blends into the tooth. You don't see where the fracture line was. So I keep on taking my REJ, pushing that in. Other instruments that are nice, Cosmonet makes a very, very nice IPC thin blade. The aesthetic contouring instrument from our clinical research, very, very nice. So basically, I'm trying to blend this in. Now, if you see the fracture line, you don't have enough material on there. I want the fracture line to disappear. Now, these are what I was talking about. Here's Brush and Sculpt from Cosmonet. You have resin blend here. And the wetting resin from either Bisco or Ultradent, very, very nice materials. There's a difference in the filler content, okay? So I put the brush into the wetting agent, and then what I do is I prime it. So I don't really want material to be used, you know, to make a shine. All I want to do is be able to smooth this composite out, blending it into the tooth. I don't want to see any lines. I don't want to be able to ping a margin. Okay? And then you can see from the side those 3 developmental progressions. I'm going to light cure that. And if you see where the fracture is, you can't proceed to the next step. If you have too much, you're going to have to drill it off and start over. But try to take your time. You don't need a lot of material. It's very, very thin material. Then I want to show you how we create the translucency. Okay? So that's what we're looking at right here. Have the dentin shade on. What I've done is I put a mylar strip in between the teeth, because this is going to be my first pull-through technique, okay? What I want to do is I want to protect that incisal translucency. I want to have material that goes in between those lobes. And so what I like to do is this. I like to take my gloves, clean them with alcohol, like this. Clean with alcohol, because what I'm going to do is I'm going to take now a material called enamel clear, ENC. This is a clear material because I want it just to occupy the space. All we're doing is occupying the space. And what I do is this. I'm going to take just a little piece off first again. And what I'm going to do is take the material and basically roll it into a convenience form like this. I roll it like that, okay? I may take this thinner part off. And what I want to do now, place it on my REJ 4 like this, and I come to my tooth, and what I want to do is I just want this to occupy the space. So I come here, I'm going to place this like this. I don't want to, where you get bubbles is when you start folding it on itself. So what I do is I start here, and what I want to do is physically push this in, force this between the lobes to create and keep the translucency. I cleave it off, and I'm forcing that here in between, and then what I want to do when I get to the corner is turn this up like that. Okay? I turned it up, and then I'm physically forcing this in between the lobes. Now, I am not making this thicker than the thickest part of the dentin, okay? it's not thicker to the facial than what the dentin is, and I'm filling it in. And then what I'll do is I'll cleave this off like that. And then this is my first pull through, okay? So I take my instrument here, my matrix, take my finger, I pull, push, pull, push, pull, push, and then peel it off like that. So I don't have any overhangs at all. And you can see how that will create that same translucency. Now, I want to take my instrument again and blend this in, because I don't want this too thick, because I still need room to put my enamel. But you see I have room still. I built that in. All that here is doing is occupying the space that was kept off of where the dentin was placed. And when I light cure this, I want you to pay attention to how it will form and show you the translucence. Okay? You can see we're going to have a contact because I was able to pull that through. And if I want, I can I can take my brush, blend it in, and then cleave it off like this. Cleave it off. And from the incisal, you can see I have room still for my enamel. So you can see a little piece right here. What am I going to do? Push it in. And now I have room for a uniform enamel layer. Now watch what happens here when I light cure it. So now, look at the translucency. It looks like it has depth to it, okay? And then when I put my B1 on, I'll thin that out and it will tone down that translucency a little bit. That's how you create the translucency. And you tell the patient they're going to hear a little pop. You take a thick instrument and you do this. Pop. All right? No wedges, no bleeding, no overhangs. So I'm going to take that B1 and I'm going to start with more material than I need. And I'm basically pushing this out and I'm allowing it to express itself like that. And you can see how much material I placed. Now, I want to start with more material than I need, because I don't want to have to keep on adding material, because if you add material and you fold it on itself, it can be a problem, okay? So what I'm going to do is take the material, work it down to the incisal edge, making sure I've covered my margins. And as we get up here, this is not going to be a full veneer, okay? It's stopping somewhere in where I etched and over-etched, and I'm going to blend it into the tube, okay? I'm going to blend this in, blend it toward the incisal, and what I do is I'll cleave this off, all right? I'm allowing the material, I'm not folding it on itself, I'm allowing the material to just kind of move, and as I get to the edge, I do this. I cleave it off like that. Cut it off. Okay? So, now that I have that material like this, I want more material than I need. And what I'm going to do is I'm going to do my next pull through. I allow the composite to stick to the matrix. Now, if you're using a composite that's too sticky, the pull through technique does not work very well. Sometimes you may have to lubricate the matrix with like a wetting resin. But for this Evanescence, it's a really good material to do a pull through, as is like Filtech Supreme or the microfill from Renamel. So what I'm going to do here is this. I push, pull, push, pull, push, pull, and then I do this really fast, so that I don't have any overhangs, and I'm going to have a nice contact. Now I have some finishing to do, adapting this to the tooth a little bit better, but I'm going to have a very, very good contact, with this. So I go ahead. I smudge it where I want it, the material. And then what I do is I will kind of cleave this off. And then I'll start using my brush. See, I have more room, I have more material than I need. You see how it's thicker? That's going to allow me to do finishing and polishing. I don't need that quite that much. So I can take my brush and once again can blend this like this. Making sure, that I don't have, like, I'm just trying to get some semblance of that. And you can see I thinned it out a little bit more. If I want, I can push the composite a little bit more toward interproximal. Leave it off. I don't want to see a lot of excess around the tooth where I'm going to have a margin. So I keep on thinning it out, and then when I polish it, I'm going to remove some more of that material. Okay? So you can start to see what we're trying to do. All right? The material moves really nice, stays put, blending it into tooth, keep it out of the interproximal because that's not where the bevel was, so I can thin that out. And now I have a pretty good idea of the shape. Okay. So leave some more off. I can look from the incisal, and you can see I'm going to have room for finishing and polishing. Alright, so you can go ahead and we can do that as I finish this up a little bit. making sure that I don't have any, margins. Like here. Try to get it as perfect as possible so you have less anything. Okay. The incisal. And I do this dry on lower speed. And then after I start to do this, I'm gonna build my line angles in with a pencil to show you how I create that. I just kind of get a little bit of a matte finish to begin with. Okay, so and I'm always have my assistant always has like a wet gauze to kind of like to wipe that excess off. So the first thing that I do is I like to line up this. I like to line up the facial incisal linings. You can see that's pretty close. And I want to make sure that I have like the same length of tooth. Now, I do think that number 8 was a little bit shorter to begin with. When you looked at your tooth, it was a little bit shorter in the model to begin with. So I'm not going to shorten that anymore. But I want to make sure that I get this facial where I want it, like the adjacent tooth. I want to line up that facial incisal line angle. And then I leave that. Once I get it in the spot where I want it, I leave it. Okay? I'm blending this in. Notice that I'm not taking the disc and just running it across the tooth from mesial to distal. I like to work between the line angles. Why? If you take this disc and go like this, you just go like this, your tooth's going to get too fat. I like to keep the disc into the interproximal and I move the line angle in like this. I don't want to necessarily go across the tooth and just like that. I want to make sure that we have, nice line angles. So once I get to this point here, I can do this. I can draw, I use the side of the pencil and I let the pencil draw where the line angles are on the adjacent tooth. It's the height of contour like this. So if you want a tooth to appear, the same width, then I do this. I'm allowing that to draw in. And I also, on this side here, so you can see that this is too far in. That line angle is too far in compared to this one. So what I want to do is move the line angle out. So a lot of times I'll use a smaller disc. You may not have that in your kit, but I'll take a smaller disc and I'll do this. Move the line angle out and then I'll redraw it like this. Okay, I have that like that and move the line angle out. And you can see that it's still a little bit too far in. All right, and when I look at it here, it's a little bit too far in. So I want to move that out a little bit. So I can take my disc and the thing about these little discs is you can work between the line angles a little easier. And if we don't have, I don't think we have those in the kit. We may in the future put these in because I do use these a lot. I like those little discs to work between the line angles. And then I kind of like take that off and we see what that looks like. Okay. So you can start to see the line angles and the shape of the tooth similar to the adjacent tooth. So once again, I want to make sure we get the line angles right and work between them. And you'll notice that there's not a lot of developmental depressions on this tooth. There's not a lot compared to the adjacent tooth when you look at it. You maybe see a little one like here where it shines right here. There's a depression. And then right here there's another depression. So I'm going to take my diamond, and it's just that flame-shaped diamond. And what I'm going to do is create the depression here. So I take my diamond burr, I come up, I'm using slow speed. Slow speed to create a little depression. And then I will I'm using a little bit of pressure here. Because if you don't have a lot of anatomy, then you're just going to, create this. If I don't have a lot of anatomy, I'm just creating what I see on the adjacent tooth. I don't have a lot of finishing and polishing to do. So what I want to do is show you this, and you'll start to see it shine similar to the adjacent tooth, where it's just very little depressions. Look at the depressions on here. You can see it with my black background. Now, if that's all I have, I go right to my ASAP polisher. It's an all-surface access polisher. And these are the ASAP dailies. One is purple and one is peach color. So what I'm going to do is just come here and I'm going to polish this restoration. I'm using quick strokes, low speed, around 6,000 to 8,000 RPMs. Okay. You can see a little bit of the depression. And then I go to my peach one. And then I'm going to go to my final, I'm going to show you another way of doing it. So we have this. And this is the final one. They work extremely well. You can see the shine that you can get on that restoration in a matter of, a few seconds. Wipe that off. So that's just using the discs and the polisher, okay, with no enamelize. And you can see the anatomy, okay? They're very, very small. See, I do not like this tooth, that developmental depression like that. So what I want to do is this. I'm going to take this and I'm going to show you how to create surface texture that really matches a tooth a little bit better. So I'm going to come here and I'm going to take my diamond burr and I'm going to go a little bit deeper. Usually the mesial depression is a little bit taller than the distal. Like that. And I'm going back and forth on low speed. As I get to the edge, I'll use a swinging motion like a pendulum. This is somebody who has a lot of surface texture. Going back and forth with that diamond, and you'll start to see the texture. Okay? Once I have that texture where I want it like this, or the anatomy, and I'll show you from the incisal edge. Okay? Let me show you from the incisal. The texture, the enamel, and you have like a little split lobe there. And now if I want to create the paracomata or imbrication lines, I take my diamond like this, and watch this. I go like that. I leave that on the powder on there, and then I go to my groovy diamond polisher. Like this. And I'm going to kind of give it a high shine. You won't get rid of the surface texture, okay? Won't get rid of the surface texture, but it will give you the kind of like the paracomata. And the last thing that I'll do is I'll take my enamelize on a flexi buff. Watch the shine now, and then you'll be able to see this shine on the tooth. So I come here, my tooth like this. Turn the speed up a little bit. Watch how you're going to see a nice shine here. This is a flexi buff from Cosmodent. This will show the surface texturing and the polish. Really, really nice. And that way you can get a really, really nice surface texture that looks more like a tooth versus just a smooth tooth. And this is from Cosmodent. And then I'll use either some Epitech strips from GC or Flexi strips from Cosmodent.
Event. We trust that you valued this online hands-on learning experience. After we have verified your attendance, you'll receive an email within 24 hours instructing you to complete the course assessment. Please complete this assessment as soon as possible to receive your continuing education credits. Please note that 80% is required to obtain your CE credits. You'll have unlimited attempts to achieve this threshold if necessary. Once you have successfully completed the assessment, you will receive an email granting you access to participate in this same course in an on-demand format available 24 hours a day for the next 30 days. Please visit handsonlinelive.com to stay up to date on upcoming live courses, on demand, and live demonstration webinars. Thank you again for your participation.